Thank you. So my name is Kenneth Juma. I am a senior research officer at the African Population and Health Research Center. Today we have launched a study that documents the incidence of abortion, that is the total number of abortions that occur in Kenya, as well as the severity of complications. Uh, Severity of complications related to abortions that are treated in our health facilities, as well as the preparedness of the health system to address the challenge of post-abortion care. So the study details provides a lot of data points and information that can be used by all stakeholders to develop interventions to address the challenge that affects a lot of women and girls around abortion. Findings report or present that a total of about 792,000 induced abortions happened in Kenya in the year 2023. At the same time, when you look at the rates of unintended pregnancy, indeed, unintended pregnancies have reduced. However, abortion rates have slightly increased. What this means is that there's the pressures of society around women and families wanting fewer children. Unintended pregnancies have reduced because there have been efforts by stakeholders to improve access to family planning, which is really important. At the same time, there's still a lot of work to be done around improving the capacity of health facilities to provide this critical and life-saving intervention on post-abortion care. There's been a great progress in the country comparing with what we did in 2012. So we think we're at a better place, but more work needs to be done. The study reveals that only 18% of primary facilities, that is level 2s and 3s, could provide basic post-abortion care. That is a very small number of facilities. And this is important because majority of women reach or get to primary facilities first to get care before then they're referred upwards. So when health facilities at the primary level cannot provide post-abortion care, then it means they act as a relaying belt. They arrive there and then they're referred upwards, which then creates overcrowding within health facilities at level 4s and 5s. That ultimately also reduces the experiences of women because they get there, there's a long line, a long waiting time, and also the complication may worsen. So one of the recommendations we have is to improve the capacity and strengthen the capacity of primary facilities, the dispensaries and the health centers, to be able to provide basic post-abortion care to a majority of women that get there. At the same time, once these women are referred to level 4s and 5s, again, there's no guarantee that they will get the care they need because only a quarter of referral facilities could provide all post-abortion care cases, care. So there's also need to strengthen care at the referral level to ensure that for all women that get to those levels, they're able to access this life-saving post-abortion care. That one of the greatest drivers of abortion is unintended pregnancy. And unintended pregnancy is one of the driving causes of unintended pregnancy is sometimes they're not using modern and effective contraceptives. So we see that as our greatest entry point in terms of ensuring that there's great awareness at the community level and at all levels basically to ensure that women are able to access modern and effective family planning methods to prevent the occurrence of unintended pregnancy.